Well, we're now coming to the end of another American Heart Month, 4 weeks of education on the very real problem of heart disease in our country and certainly our valley. Coronary artery disease, the #1 killer of men and women in the U.S. Patients with some risk of heart disease may consider screening with advanced imaging of the coronary arteries. My newsmaker tonight is Dr. John Feller from the Deseart Medical Imaging Group in Indian Wells. They provide just that type of medical service we'll talk about in a minute. Doctor, good to have you with us. First of all, how are we doing? I mean, we have 1 month when we have all kinds of stories and we talk so much about it, but heart disease remains a very real problem. And I've got to think one of the main reasons is our obesity epidemic. Would you agree?
Yeah, absolutely. I mean, this obesity epidemic that affects about 1/3 of our population now is driving, increased type 2 diabetes, increased acute coronary syndromes, which are these heart attacks and strokes and other cardiovascular problems. So that's a huge problem.
If there is one thing that you would recommend, sounds like lose weight, but if there's one thing that you would recommend that people do to battle this increasing problem that I think hits men perhaps more than women, and it hits people as they age more than younger people, what would it be? What is the one thing we're not doing enough of?
Well, I think really knowing your risk factors and then managing them. If you have high blood pressure, get that under control.
High cholesterol?
High cholesterol, get that under control. You're a smoker, stop smoking. Sedentary lifestyle, get some exercise.
Yeah.
So it's really about knowing your risk factors and then managing them.
Yeah. Now, you're in the high science of this whole deal right here. Are we making advances that, in your opinion, will help us in the years to come to battle heart disease in ways that we haven't been able to perhaps in the past?
Absolutely. It's still the case that the first time a patient has symptoms from heart disease, 30% of them die. So whatever we're doing for screening, we need some newer things to come into play. And one of those is this new type of CAT scanning technique where we look at the little arteries that supply the heart non-invasively.
Am I talking about the CT coronary angiography? Is that what you're talking about?
Absolutely.
This is new. Tell us about that. You're doing this in Indian Wells, correct?
Yes. We've been doing it for about 5 years here locally, and it's a non-invasive test. It just requires an IV and a special type of CAT scanner and then special doctors that have training in interpreting them. But in a single breath hold, you can assess whether or not those arteries supplying your heart are clogged or not.
Is this a lengthy procedure? Is it an expensive procedure?
It's not a lengthy procedure. The whole test is done in one breath hold. So 15 to 20 seconds, maybe 30 minutes total time for the patient. Expense-wise, it's about what people might pay for their car payment for a BMW for a month. So
well worth it.
Absolutely.
Yeah. So if you suspect you have it, I mean, you talk to your personal physician, I guess, and perhaps they would refer them over to someone like you who does this at Deseart Medical Imaging in Indian Wells, or other places, I presume, also do it around here. Is that accurate?
Absolutely. And it's especially useful and cost-effective, we know now, for patients who have either low risk or intermediate risk for coronary artery disease. High-risk patients still need to go with the standard nuclear medicine stress test with or without the catheter angiogram.
Okay. All right. It's one of those things that, I mean, it's a 12-month deal. We can't just have 1 month of February and talk about heart disease. It's really a very serious thing, the #1 killer men and women in our country. So thank you for coming in and shedding a little light on it. Dr. John Feller, we appreciate our newsmaker today.